And we are back with On the Record with Tiffany. And I'm here again with my special guest, Dr. Richard Gibney. Dr. Gibney is the president of Empowered Kidney Care. Dr. Gibney, how are you doing today?
Again, all is well. If you're in Texas, you're just the luckiest person in the world. So all is good.
I know Texas is. We're so blessed with great weather and a beautiful scenery here in our great state. You know, I'm Texan through and through, right down to my cowgirl boots. So, well, today I wanted to talk to you about our healthcare system. You know, often we're hearing so much about healthcare and how we can change and what we need to do as a system. What are your observations as someone who's been in healthcare for the last 40 years?
The social determinants of health is sort of it's embarrassing to tell you, but sort of a new thing, because if you went to a office of a physician, or if you went to the chart in the hospital, there's the diagnoses of diabetes, hypertension, high potassium, seizures. And you fix all those things, and then pow, you're gone. And you say, well, what about the social determinants of health? And you go, well, that's hidden somewhere in the bottom of the chart, but you know, it's not my job. It's not my job is kind of the mantra that, you know, I do purely the medical part.
And Dr. Gibney, will you define for our listeners what social determinants of health are? Because I don't think a lot of people necessarily know what that is.
Social determinants of health are the situation you're living in. So if you have no money, if you have no food, if you have no house, if you have
transportation,
you have no, if you're in a violent atmosphere, all of these put you in a situation where you are going to be much more vulnerable and you're much more marginalized as far as what's going to happen. So when something happens, you'd say, well, that was real bad. Well, how did it work for the people that are poor, the people that have all these disadvantages?
And for our listeners, you know, that right now in our nation, there are 140 million people who fall below the poverty line. So we have 140 million people who are defined as poor in our nation. That's a lot of people who are affected by social determinants of health.
So again, the question becomes, what can we do to help these people? Meaning, again, it's kind of the same story as what I've talked about before. Are we willing to go to these people, the poor and the marginalized, and develop a relationship-based program? Meaning, where you say, well, you say that you love the poor. Well, tell me their names. And you say, well, I don't know anybody actually. Well, you don't have to know anybody, but you get a sense when you're in the trenches of what's going on. So we have to have programs that specifically go to these. And I'll give you an example. There's a thing called social determinants of health.org. It's a thing that looks at all your zip codes all over the country, and then looks at all these things like housing and food and transportation, et cetera. And then can say, here's where the problems are, how severe it is or how not severe it is. The good news is that identifies real quickly, kind of in a broad stroke, what's going on. And then luckily in Waco, Texas, we have a extraordinary, a holy man, a rock star, a prophet. This guy's name is Jimmy Durrell. Jimmy Durrell, 40 years ago, bought a house in the worst area in Waco.
Okay, I know that name. I know who you're talking about.
Superstar. He is
He
a
is.
genius and a dear, dear, dear friend. And the whole concept from him is that we empower people medically, and we have very similar journeys. So this is the same story of you've got to develop a relationship if you expect to help people. You can't
Exactly.
say, here's something for you, goodbye.
Mm-hmm.
You haven't done anything. You also have to focus on the systemic injustice among the poor.
Mm-hmm.
This is not to say you're bad or good or whatever. The truth is there is systemic injustice among the poor. Why? They're poor. If they're poor, they don't have the resources and the tools to get the same kind of fair opportunity, equitable opportunity that everybody else has. So we've got to figure out ways to make that happen so that they get a fair, equitable opportunity, just like everybody else. And then finally, we've got to figure out how to get more people involved. You know, whether you're a middle-class person or a rich person or whatever kind of person, how can we get you involved where you can become compassionately involved in caring for the poor? Everybody you talk to, that's part of that. That's supposed to be part of our DNA. That's part of what we do. That's why America is the greatest country in the world. Anytime anything bad happens, we immediately run to try to help people.
And you know, COVID-19 has really shown that the love and compassion that we've been rushing around and kind of forgetting about because we're so busy, it's there. It's there. You see that love and compassion for our fellow man displayed every day throughout this pandemic. If there's anything that is to be gleaned from this, it's that we are stronger together, and we are behaving like we're stronger together now.
So, for example, this Jimmy Durrell, Mission Waco, what he does is he doesn't give anything away. Everything that they do, they charge for. But, you know, they may charge a quarter or a dime. But again, why that's important is they have ownership. That patient or that person has ownership then. And so, like, he's got a grocery store in the east side of Waco where there was never a grocery store. He's got a cafe. He's got a clothes store. He's got a whole bunch of different jobs place, a drug rehab place, a whole bunch of different stuff that's real stuff in the trenches. And the key to this is you have to hire the people from that community. So you can't hire people from somewhere else. Mm-hmm. So the poor people, the people that used to be drug addicts or have psychiatric problems or all sorts of disabilities, that's who work at the cafe. That's who work at the grocery store. And they have tremendous pride and tremendous joy in this. And it's a reflection on the community because they know the community knows them. And that's exactly what you want to do is you want to build on the community and all of the resources of that community. So huge opportunities. And the punchline is this. So myself, I'm guilty as everybody else, but we did the patient came in and he had diabetes, kidney failure, hypertension, seizures. So we fixed it all up and we sent him home. Next week, he comes right back in. We go, well, that's a bad patient. He's terrible. He's awful. Well, he didn't have any money. He had no transportation. So how did you think he was going to get his medicines with all these barriers in his way? So we've got to do a better job of doing the social determinants. And if you'll do that, these same people will rise up and become marvelous members of our community, doing all these good things that they never were given a chance to do.
There's something empowering about having a certain level of responsibility too. When people have to earn each one of those little accolades, there is power in that. There is power, personal joy, and power in making your own way. Everybody feels great when you achieve something that you set out to do.
Yeah, it's a wonderful way, so to you, everybody's heard this, that too much that is given, much is expected.
Mm-hmm. To whom much is given, much is required. Yeah.
And then look at this. If you look at medical care, 80% is related to behavior and social. So we spend all of our money on the 10% medical, and you say, well, what about the behavior and the social? Well, that's somebody else's job, there's a disconnect here. And so hopefully in the near future, we can connect this disconnect and say, give patients control, dignity, and hope. They'll change the world. Give patients the social tools and resources they need. They'll change the world. And a lot of the things that we've never been able to fix are going to change in a powerful, wonderful way, beautiful way.
Thank you so much, Dr. Gibney. You're listening to On the Record with Tiffany, and I want you to come on back and listen to our next segment because Dr. Gibney is going to teach us more about empowerment, social justice, and our healthcare system. We've got a task force here in Texas that Dr. Gibney is a part of, and I believe he's going to be a huge help to the task force. I'm looking at your face, Dr. Gibney, like, you really are. Your experience and longevity in this is exactly what our members need. And you're going to hear more about where we're going with this in the next segment of On the Record with Tiffany. So come on back.